So we are lucky that for both the female cancers we have screening programs. We do not have screening programs which can help detect cancers for all sites. So I guess we women should be thankful to God for that. For breast cancers, we need to begin with a breast self-examination starting at the age of 30, which has to be done monthly, which you must go and learn from a practitioner and then carry out monthly on yourself. A clinical examination, that is an examination by a doctor, should be done once in a year. Beyond the age of 40, mammography, which is an X-ray of the breast tissue which is taken, that should be started after the age of 40 years and done once in a year or once in 2 years. Apart from this, for cervical cancers, there is an investigation known as pap smear or HPV co-testing. These should begin at the age of 35. In the US, it is started at a much younger age, maybe around 21 years of age, but for the Indian subcontinent, starting at 35 is what is the guideline. It has to be done once in every 3 years, and if it's a co-testing that is being done, then once in 5 years. Once 3 tests come negative, then the frequency can be reduced to once in 5 years. And if a patient has regularly had negative reports of the pap smear and the co-testing of HPV, then beyond the age of 65, the testing can be stopped. As for ovarian cancers, there are no per se symptoms or regular screening tests apart from a blood test, that is CA-125, which would be elevated in some kind of ovarian cancers. So what needs to be done is actually that you also need to be aware of your body. If there are any changes that you see, any swelling, any lump, you observe any change in the menstrual cycle or the bleeding pattern, any heaviness in the abdomen, or the changes in the breast, like there could be lumps, there could be a skin change, there could be discharges, there could be ulcers, or simply an enlargement, you should be aware and go and get it checked, because rule number 1 would be prevention, and rule number 2, which helps us win cancer, is early diagnosis. So the moment we catch it early, we are stronger than the cancer and we have a much higher chance of cure. For example, if patients are not aware and they are diagnosed much later, the chances of cure fall down drastically. And that is the reason probably the cure rate in India is slightly lower than the Western population, where people are more aware. So as a country, we need to work on that.